So Jessica, you said it took about 2 weeks to really activate those muscles and really feel confident in the exercises that you were doing. Were there, when did you start seeing improvement in your symptoms of UI?
Probably say around halfway through the program.
Oh, wow, that's great. And you did the full 12 weeks, is that correct?
I did.
Lovely, very good. And how was it in terms of carving out those 5 minutes a day?
Um, it was, you have to commit.
Yes. Yeah.
Um, it was easy in a sense that it's right there. There's really no time commitment, but it's, you have to carve out that time in the morning and in the evening. So I pride myself on being a consistent, person.
You're a
But
marathon runner. You used to
towards,
discipline. Yes.
right. But towards the end, I was like, all right, like we're in the final stretch. Let's do this.
Yeah.
So easy, definitely in terms of ease of use, but you have to be dedicated. And I just kept thinking to myself, I remember when I initially started talking to the Levo rep, she's like 12-week program and your pelvic floor is healed. And I'm like, but like really? Like really, really? It's healed? Just 12 weeks. That's all you need? And
No
she's
one
like,
believes us. No one
I
believes us.
know.
But it's like any other muscle in your body. You have to rehabilitate it, and um, ac- we don't actively engage that muscle. And a lot of it's not even taught in basic anatomy courses. So it's really great that you were able to keep motivation. And did you find that improvement in symptoms kind of pushed you through and got you to the finish line, or how did you
Yeah.
stay motivated mentally?
No, absolutely. I needed to see those changes. That helped a lot.
Good. So when did you finish the treatment course?
Um, Earlier this year, I
Great.
finished.
And then do you feel improvement is continuing? Do you feel like you're at a new baseline? Are you happy still with the results?
Yes, yes. I'm definitely at a new baseline. Um, I can do things that I haven't done in a really long time, like
As, yeah.
jogging or
Yay.
yeah, taking my
Yeah.
kids to the trampoline
I was
park.
just gonna ask, do you go to the trampoline park? They are so popular around here, and that's one of the main things. People are like, I can't go to the trampoline park. So that's really awesome that it worked for you.
Yeah, yeah.
Yes. Beginning of this interview, we talked about issues of most concern that you described. What has changed since using Leva? So I know that you're able to engage in your normal daily activities. You can interact with your kids. You can run after them. You can jump with them on the trampoline. But any other improvements or improvement in your mental health or confidence?
I mean, it's like when it's not happening, you're like, okay, life is great. But then when I think back
Mm.
on what I constantly had to worry about, and that's like grabbing a pad and
Yep.
not just a regular pad, because I learned about poise, and poise they don't just make diapers, they make incontinence pads.
Yep.
So just making sure I had a constant stack of poise on hand, being worried if I didn't, worrying about leaving the house without putting a pad on, worrying about having extras with me, being out in public and leaking. And that's not just with jumping or running, but that's with sneezing or coughing or even like yelling loudly to or at my children. It was just kind of any time really that I was kind of overexerting in any way. And now I don't have to worry about that. So it's overall mental health, it's overall everything improvement. My one of my very good friends struggles with really bad UI, and I've been telling that like the minute I got this device, I was like, you need to get it. You need to get it. You need to get it. And I guess she kind of put it off, but she texted me like 2 days ago and she's like, what's the name of that device anymore? I'm on a walk and I'm just like, sorry, I'm completely like just soaked. I just peed everywhere and I'm just walking outside like in the middle of a work day. And once again, I told her like this will change your life in so many ways. So I can't speak highly
Yeah,
enough
I mean,
about what it did.
that's the reality for many, many women. You are not alone. Your friend is not alone. So word of mouth is the best way to recommend, especially when you've been through similar situations. But so am I understanding this correctly? You don't wear pads anymore.
No, not for incontinence. Nope.
Amazing. That's fantastic. That's really fantastic.
Yeah.
So I'm happy for you. Very
Thank
good.
you.
It paid off. So in your experience, what are the greatest benefits of using leave-in?
Just that it teaches you how to do a pelvic floor contraction and strengthens your pelvic floor in the comfort of your own home.
Yep. That's awesome. And then you already stated that you've recommended it to friends. Have you recommended it to anyone else in your life?
Yeah, I recommended it to my mom, who, recently was told to go to pelvic floor therapy, to actual pelvic floor therapy. And she's retired, so she has more time on her hands, but she's like, that's too much. It's
Yeah.
just too much. So I've recommended it to her too.
Yep. Yep. And it's difficult too, because when, as a physician, sending patients to physical therapists, I'm very aware that it is a sensitive exam. And, I have my patients know me and we have a rapport. And whenever I refer them, I make sure I refer them to specific places that I know they'll be taken care of. But it is a really difficult thing to kind of wrap your head around and even get to PT. And physical therapy is amazing. I definitely advocate for it. It's part of virtually all of my treatment plans for pelvic floor disorders. But the benefit of LEVA, from my perspective, is the home access, convenience, logistics, and compliance, as we said, and it works. So time and time again, I hear patients say very similar outcomes. They're not leaking anymore. They're able to do activities. They don't have to pay for pads or other devices. So that really is awesome to me. So as a patient, Jessica, what would you say to healthcare providers to kind of help them understand patients with UI, or the needs of people with UI?
Um, I think people with UI need to hear about Leva. So I would just say to, for OBGs or anyone that sees women with pelvic health issues, to recommend Leva,
Mhm.
just because there was no other treatment that existed like that, and there's nothing else out there now. So sort of revolutionary, and why wouldn't we want to tell everybody about it?
Yeah, yeah. And I kind of, to echo what you said in the beginning, I think just asking, I think healthcare providers asking to identify the problem, because I think it's chronically underdiagnosed or not discussed at all. I think that's the first step, because as new technology develops, as these new solutions develop, we will be able to provide solutions, but we also have to be able to identify the issue and talk about it, so patients aren't abandoned or going on YouTube, like you said, and getting information that is probably good. There's a lot of good stuff out there, but we want to make sure we're providing sound medical advice and taking the best care of our patients. What would you say to people with UI to help them with their UI management? Try
Um,
leave.
yeah, try Leva. Um,
How about talk to your healthcare provider about this, because it's an easy as a referral, a prescription. Leave is very organized. The doctor just orders it and sends it off, and then they take it from there. So it's really not a heavy burden on the office staff. And like, as we heard from Jessica, it's pretty easy to obtain, use, learn how to use, and complete. So that's really good. What advice would you give healthcare providers to help their patients utilize the LEVA system? So I'm going to take this question. So I think, one, learning about LEVA is really important for all providers in the primary care world and OBGYN. Anyone who deals with women, I think it's important to address. I think that LEVA, logistically, they have a great support team, but it's also very easy to incorporate the orders into the electronic medical record. They provide informational handouts so that you can give those to patients, and then you can send the order off very easily. So it's not a huge burden, and they're very responsive. So from placing the order to receiving the order, it's a matter of days. It's not weeks or months that patients are waiting for this device. So I want to say thank you so much, Jessica, for sharing your story. As I said before, this really is not discussed often, but it's a major issue and we need to talk about it. I feel like people are more likely to talk about their blood pressure medications, maybe at the dinner table, but they're not going to talk about leaking. And I think runners, people who are active, or even patients who are in the postpartum period are all kind of dealing with these issues, and we really haven't been mainstream with it. One thing that I do in my practice is I have questionnaires where I fully assess. I ask very detailed, specific questions, but specifically looking for these things. But I have had training in specific fellowship training in that. And my hope is that devices like Leva and even doing programs like this spreads the word, and that patients don't need a referral to me to be able to obtain treatment. So I hope that there's a lot more widespread access to pelvic floor care. So Jessica, you're not alone. It's about 62% of patients greater than age 20 will suffer from some type of urinary incontinence. So it's not just a condition of older age. It's not a condition that happens after childbirth. It can, but it can happen even before all those things develop. So I think also early intervention is really important. And my field of urogynecology is also trying to emphasize prevention of pelvic floor disorders later. So ways that we can do that is increasing pelvic floor rehabilitation after delivery, addressing it at women's exams, and really keeping up to date on things that are evidence-based. So Leva has really good data that's been published in urogynecology journals with data that says the results last up to 2 years. And it probably would extend more, but that's how far the study goes. So I think it's really important to screen patients, diagnose it, and then also provide solutions. So patients don't feel lost or left wandering the internet trying to find a solution. In terms of treatment of pelvic floor disorders, specifically urinary incontinence, this is a really cool device because it's motion-based and it shows up on your smartphone, which is really nice because most people have smartphones these days. And I offer this to patients of every age, and I find it age does not limit ability to participate in Leva, and that it's actually very easy to use, especially with the customer service end of things on their part. In terms of first line care, pelvic floor physical therapy in general can work just as well as medications. So if we rehabilitate the pelvic floor, we can get patients dry without needing medications or invasive procedures. So I think the niche that Leva provides is it provides access for patients to be able to do this at home. And especially with busy lives, they don't have to go make an appointment. And even pelvic floor physical therapy can be difficult to get into with wait lists that can be months. So this is a really nice solution. I'm so happy that people have investigated this, spent time in developing this technology, and really getting the insurance coverage for it. It's phenomenal. Pelvic floor muscle training is recommended as first-line therapy, and Leva specifically is indicated for a variety of pelvic floor disorders, including overactive bladder, urgency incontinence, stress incontinence, which is leaking with coughing, sneezing, running. And it's also approved for something that we didn't touch upon today, but it's another topic that's not really discussed, fecal incontinence. And that can happen after childbirth. It can happen due to pelvic floor disorders. So that's also a really unique option of Leva because we don't have a lot of treatment options for FI. Once again, I just want to thank you, Jessica, so much for being here and sharing your story. I hope this gets to many women, and I hope that we are able to spread the good news and get access for patients.
Thank you so much, Dr. Carr, for having me.
Yes, of course.